Now to the COVID surge. The U.S. is breaking new records as the highly contagious Omicron variant continues to spread. In just the past day, more than 1.3 million Americans tested positive for COVID. That's the highest daily number since the pandemic began, and it breaks the previous record that was just set last week when a little over 1 million people tested positive in a day. This comes as number of Americans hospitalized with COVID surpasses last winter's peak, and areas first hit hard by Omicron are now seeing a rise in COVID deaths.
There has been more deaths that I've seen the whole time in just 1 week that I normally see in a month, let alone in a day.
All of this happening, of course, despite vaccines being readily available and 63% of the country being fully vaccinated against the virus. NBC News medical reporter Erika Edwards joins us now. Erika, good morning. So vaccine makers are now preparing to roll out boosters that are specifically meant to target Omicron. They say they could be available later this spring. First, tell us what you're learning about these boosters, but then what does it mean for people? Would this be a fourth shot for people who were already boosted? And also, could these really still be necessary by then if they're not available till the spring and we're experiencing this right here at the start of winter?
Yeah, good morning, Savannah. Those are all really good questions. Both Pfizer and Moderna are working on vaccines specific to the Omicron variant. You know, this is after there's some data out of the UK that shows that protection against symptomatic Omicron infection falls to just about 10% 4 months after that initial series. Now, it's unclear still where this would fall in the process. Would it be a booster? Would it be a fourth shot? When would it be needed? Omicron is spreading so rapidly that some are saying, you know, perhaps we won't end up needing this. It would just be part of, you know, that annual shot that we get. Now, both CEOs of both companies were on CNBC yesterday to talk about their work.
We're working very actively on an Omicron-specific vaccine as a booster. That should be in the clinic very soon.
This vaccine will be ready in March. I don't know if we will need it. I don't know if and how it will be used, but we'll be ready.
Yeah, so it's also important to remember that both of these vaccines do remain quite effective at preventing the most severe complications of COVID-19. That's hospitalization and death. Savannah?
Now, Erika, one of the other big issues we've been seeing is the fact that if you are feeling sick, maybe especially during this Omicron spread, obviously we know 1.3 million people just tested positive yesterday. If you are feeling sick, you can't get tested, and therefore you might be going out and spreading it. But it soon might be easier to get those kits because the Biden administration says private insurers will have to cover the costs of, get this, 8 test kits per family member each month. Tell us how this program will work. How will people be able to claim those tests?
Yeah, this is part of a big push by the Biden administration to really try and meet that massive demand for those rapid at-home tests. People with private insurance will be able to get those tests at certain pharmacies without any out-of-pocket costs. Others and other scenarios will need to file for a reimbursement. Now, this is in addition to the tests that are already free. Those are, if a doctor orders a test for you specifically, those are also going to be free of charge. Savannah?
All right, that's good news for people. Now, Erika, we've heard how hospitals are so overwhelmed dealing with an increase in patients and staffing shortages right now, again, breaking records. Now we have Merck saying its authorized COVID pill works well against Omicron. How does this treatment work? Remind us, because I think a lot of people forget that it's available or haven't had to have that experience. And also, what's the rollout been like so far? Is it in hospitals and available to use?
No, not quite yet. The rollout has been pretty patchy. The Biden administration ordered about 3.1 million courses of the drug late last month. Most of those drugs will be available later this month. Now, it was an executive of Merck who said during a healthcare conference that he believes that the pills are effective against the Omicron variant or other variants that may come down the road, although he didn't offer any details or any new research to sort of back that up. We do know that in November, Merck released some pretty disappointing data from its drugs, saying that they're only about 30% effective against hospitalizations and death. Savannah?
All right, Erika Edwards, thank you so much for bringing us the latest here.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.